Here's our takeaway message. The electronic health record, or EHR, has the potential to be a powerful tool that truly augments patient care. But in its current manifestations, it can be time-consuming and onerous, and EHRs often do not seem to be structured around patient care itself. EHRs contribute to burnout and facilitate bloated notes in which narratives and decision-making processes are buried or lost among extraneous or copied information. In order to fix this problem, we first need a common language with which to describe it. To that end, we propose the development of scientifically sound, standardized metrics of EHR use and note quality. Hi, my name is Mark Isco, and I'm a clinical informatics fellow and emergency physician at Yale School of Medicine. I'm going to talk briefly today about a perspectives piece that I co-authored with Robert McLean and Ted Melnick, also at Yale, that'll be coming out in the November 2022 issue of Mayo Clinic Proceedings. It's entitled Restoring Meaningful Content to the Medical Record. Standardized measurement could improve EHR utility while decreasing burden. As we say in the piece, such metrics could help identify specific targets for EHR improvement and illuminate a path forward toward an EHR that facilitates rather than impedes care, augments clinician reasoning and decision-making, and offloads mundane tasks, thereby supporting sustained attention on patients, their complexity, and their humanity. In the piece, we give a brief summary of the history of the medical record and place the current EHR in that context. And we discussed some existing metrics of EHR use and note quality. But what I want to focus on here is steps forward, future directions, and we organize that around 5 specific domains. First, we propose metrics around note quality. Specifically, a metric of note quality should capture whether a note adequately conveys the patient's narrative and the clinician's reasoning and decision-making process. Put differently, can you read a note and understand what happened with the patient, what the clinician thought was causing it, what they did, and why? Second, we propose usability metrics. How efficiently and effectively can clinicians and care teams utilize the EHR and its notes? How usable is clinical decision support, and does it actually affect patient care? Third, we need standardized safety metrics, and these must include metrics that examine safety issues potentially introduced by the EHR itself. Of course, clinicians are not the only users of the EHR. Now more than ever, it's easy for patients to access their medical records, particularly in the wake of the open note provisions of the 21st Century Cures Act. Accordingly, we need patient experience metrics. Such metrics could capture how easy it is for patients, and this includes disadvantaged populations and those with limited access to technology, to view their charts and use portals to help manage their health. Patient experience metrics can be either quantitative or qualitative, like a patient assessment of the clarity and accuracy of their notes and instructions. Fifth, we propose metrics around EHR vendor and health system response to issues that inevitably arise. And finally, we discuss the role of EHR log data. So this is data on users' actions that's already collected by most EHRs, as well as other EHR-based data to contribute to valuable research, including research into the process of providing care. Vendors should be encouraged to make this data available so that it can be used to improve patient care and the workplace experience. And the research implications of this are truly endless. So, how does all this affect clinical practice, and what does it mean for patients? Well, the EHR is more than just a record. It's the primary technology through which we conduct patient care. We also know that it's a major source of frustration for both clinicians and their patients. We know we need changes, but getting there is challenging. In this piece, we argue that EHR metrics, and especially note quality metrics that are clearly defined, valid, precise, reproducible, and relevant to both patients and clinicians, could help identify current challenges, motivate change, establish best practices, and ultimately track progress. The computer will continue to play a key role in the next chapter of the history of the medical record and of medical research. Shepherded well, it can be a resource that helps clinicians deliver the highest quality of care in an efficient manner, maintaining focus on the narratives, concerns, and humanity of the patients in front of us, while simultaneously managing the large and growing amounts of data that now play a role in clinical care. Thank you so much for watching, and thank you to the Mayo Clinic Proceedings for publishing our piece. I really hope you read it. Please feel free to reach out to me at mark.isco@yale.edu if you have any questions or comments. Thanks again.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.